Hi, I'm Tom Heaselgrave, one of the neurology residents here at Willows. We've got some questions just to go through for today. Hopefully we can sort of help clarify certain aspects. The first one that's sort of come through says, what are the sort of common signs of intravertebral disc disease and how is it diagnosed? There's a broad sort of range of signs that we can see with patients. It very much just depends on sort of the severity of the initial injury and the sort of location along the spinal cord for the disc disease itself. Initial signs that we'll tend to see will be pain in the neck or pain in the sort of mid to lower back, depending on where the location of the disc extrusion is. If the disc then becomes more compressive or causes more of a contusive injury after coming out and starts to affect the spinal cord more, we'll start to then see things like weakness and wobbliness in the limbs, which then eventually will progress on to patients not being able to walk and either not being able to walk in just the back legs or both the front and the back legs together. This then eventually progresses on to patients not having any movement, even with support in their back legs, more typically, or potentially their front and back legs. And then eventually the sort of worst case presentation would be patients that sort of can't feel their toes when we're giving them a little pinch or a squeeze. And that would be sort of more of a sort of urgent presentation at that stage. In terms of the diagnosis, so there's a few ways that we can do this. Most typically, what we'll do is sort of an MRI scan of the region of suspicion, so either focusing in on the neck or the mid to lower back. In some cases, we'll also utilise things like CT scans. It depends a little bit case to case, but definitely we have a sort of tendency to use the MRI scan for that sort of diagnosis here. The second question actually leading on to this is what is a hemilaminectomy? A hemilaminectomy is a surgical procedure that we tend to utilise for those sort of cases. The aim with a hemilaminectomy is essentially to create a window within the vertebral column that will allow us access to the vertebral canal. Within the canal sits the spinal cord, and normally if we're doing this procedure, will also be some disc material and maybe some hemorrhage or a hematoma. Typically via a hemilaminectomy, the aim will be to then remove all the excess material within the canal and give the spinal cord then some space to sort of start healing and start that process and remove all of the compression that the spinal cord's under to hopefully start the sort of healing process with movement in the limbs. The next question that we've got is, why are certain breeds more predisposed to certain neurological issues? So there are certain breeds that are predisposed to sort of from a genetic variability to certain conditions. So that would be if we think about, for example, our sort of epileptic patients, there are certain breeds that from a genetic standpoint, unfortunately have a sort of higher prevalence of having idiopathic epilepsy. Going back to our disc disease, there are again sort of genes that have been found that do mean certain processes occur, such as the sort of aging processes of discs, but just at an earlier age in certain breeds that are predisposed. So for example, our Dachshunds, our French Bulldogs, Cocker Spaniels do typically have that sort of process happening where the disc ages, just at a sort of earlier standpoint, which then means they have to go through the normal day-to-day wear and tear, but just on discs that are a little bit sort of older than they technically should be. By us having all these variation of breeds and sort of a great variation of species, inevitably we end up sort of breeding into them diseases that are going to be more or less common just via their sort of routes of selection for particular breeds. Our sort of final question here, which is asking us about what is MUO and how is that treated? MUO stands for meningoencephalitis of unknown origin, or it can stand for meningomyelitis of unknown origin, or meningoencephalomyelitis of unknown origin. It's sort of the umbrella term for the immune-mediated conditions or inflammatory conditions that we get within the central nervous system, whereby a patient's own immune system is starting to inappropriately attack certain parts of the nervous tissue. So if that happens in purely the spinal cord, that's where we call it the meningomyelitis. If it happens in just the brain, it's the meningoencephalitis. And if it happens in both, that's where we get the meningoencephalomyelitis. Of unknown origin is just the sort of phrase that we use At the minute, we sort of know that it's immune mediated, and therefore the treatment is warranted as immunosuppression. But at the minute, we don't yet know sort of what triggers it in certain patients and why it comes on in certain patients, which is why it has that phrase of sort of unknown origin. Another phrase similar to that is sort of idiopathic. The treatment is often immunosuppression for it. So what we'll do is dampen down the immune system and try and make it sort of less active. Normally for cases of MUO, that's sort of multimodal. So we use at least 2 immunosuppressant agents at the same time. There's a variety of different ways we can treat that with varying different success, and also sort of thinking patient to patient. There's sort of bespoke ways that we can treat each patient with that sort of condition. Next time, I think we've got a session with our internal medics. So if you guys could send in any questions for the internal medicine team, anything that you definitely want answered, or sort of any queries that you'd like clarifying, that would be great. And the internal medicine team will be in touch.